All right, good evening, everybody. I'd like to call to order the January 24th, 2024 Community Mental Health Full Board Meeting to order. Please stand for the pledge. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Next item is the reading of the mission statement from Mark.
Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Next, we'll move on to item 3, adoption of the agenda. I'll take a motion to adopt.
Support.
Motion from Donna, support from Ryan. Questions, comments, changes to the agenda? Hearing and seeing none, all in favor say aye.
Aye.
Aye. All opposed? The agenda is adopted. Next, we'll move on to hearing of the public. Anybody from the public wishing to speak, you have 5 minutes. Come on up, give us your name.
Good evening and Happy New Year, everyone. My name is Bruce Dutton. I'm the director of Crossroads Clubhouse in Warren, Michigan.
I'm Angel Weiss, member of Crossroads Clubhouse in Warren, Michigan.
So one of the things that we've done in the last several years is we like to come to the board meetings and give a summary of our quality indicators for the previous year. So we're coming tonight to kind of highlight some of the things that we've accomplished this year.
Okay.
Angel?
Yeah, our average daily attendance is 24 persons. Our total attended is 5,515. Our holidays celebrated were 12, and our virtual participation was 234 times. Our tours, we had 61 tours with a number of 29 new members from those orientations, which is a percentage of 48%. Our members that are enrolled in school is 3.25, and our housing assist is 4?
4. Mm-hmm.
Okay. Employment, with transitional employment, we've had 4. Supportive employment and MRS is 4.3. Independent employment is 8.4. Sheltered workshop is 1. Percentage of members in employment is 26%. Our total TE support time in hours is 9 a month. Total SE support time is 0.5 a month. TE staff coverage, 8 hours a month. TE shifts coverage, 2 shifts per month. Total social rec activities is 27. Average monthly social rec attendees is 16. Do you want to go over the rest, or you want me to do my little blurb?
No, we'll
Finish
if
with
you don't mind, we'll finish up with
Okay, I'd like to highlight some of the stuff from our foundation. We've helped 6 people with through our housing program. We've assisted 2 improving education 2 times a month. 12 times a month we've assisted with our in-house program. We've had 3 fundraising events, which was a scrapbook event, Giving Day, and the Rockers Rockers hockey team. This year we're going to add medically things into what we are able to support. And this year we've also been given the task of being the fiduciary for the Innovative Prevention Grant. That grant will bring in approximately $25,000 to the foundation, and it's to help those that do not have Medicaid or they have private insurance or have no insurance. A personal observation of mine, I believe we have the best blend of staff over the course of the last 5 years. People have left, but not because they were fired. They retired, and they still come back. I've been coming to Crossroads since 2008, as best we can figure. And this is the best staff that we've had so far.
Thank you, Angel. So some of the other data points that we track on a regular basis is right now we have 83 active members. Out of those 83 active members, 73 of them come on a regular basis in a month. So that's right around 90% of those active members come to Clubhouse on a regular basis. Last year, we provided 4,588 meals. Of that, 213 were holiday related, and 255 of them were free meals. So free meals are events for those individuals that have birthdays. We do an annual employment celebration, so when our individuals that are working come to have join us for our employment celebration, those dinners are free. The big fundraising event that we do, or the open house event that we have in October, we use all of those funds for Thanksgiving and Christmas dinners, so that's where those free meals come in at. One of the things that's pretty cool about Clubhouse is we track recidivism, and we do that throughout the system right now. So of that 89% of those individuals that come to Clubhouse, we have like less than one person that goes in the psychiatric hospital a month. In comparison, we have about 2 people a month that go into the medical hospital. So those individuals that go into the psychiatric hospital, they're in there for less than 6 days, whereas our individuals that are going in the medical hospital are usually going in there right around 12 days. So it's kind of, that's a pretty cool statistic to track. Angel talked about our employment. Right now, we have 26% of our members doing something with employment. When we look at the numbers, the average hourly rate of pay that they're making is about $13.50. So for last year, the total amount that they made and spent in our community was $35,600. So that's pretty significant. For our outreach program, we sent out, 1,388 cards. We made 1,500 phone calls reaching out to folks, just reminding them and letting them know that we're thinking about them and come back to Clubhouse. We started we finally got a website updated and going probably about 6 or 7 months ago. So far, we've already had 171 people actively participating in the website. Out of that 171 folks, we've actually had 4 new members that have started Clubhouse. And so the website has demonstrated some good outcomes there. Social media friends, we have an average of 602 social media friends that follow us on a monthly basis, which generates a lot of conversation and communication. We have a wellness program, and the wellness program allows any Clubhouse member to either go for a wellness walk, or lately with the temperatures being what they are outside, we do sit and be fit. We have an average of 14 members that participate in our wellness program. Just for our wellness walks last year, we walked 206 miles. So pretty cool stuff. That's 65% of our current members that participate in our wellness program. Last year for our units billed, we accounted for 92,411 units of service. So we're pretty happy about that. We continue to strive to continue to be better and better. Some things that are happening on the horizon for us for this year is in July, we're anticipating getting our Clubhouse International reaccreditation. So as you know, that's a 3-year accreditation. And in addition to that, just announced by Clubhouse International is the World Seminar that's actually happening in British Columbia, Canada. So that's happening in September. It wouldn't surprise me at all if we get asked to present at the World Seminar. That's always kind of a highlight of our year. We just presented at the USA conference back just a couple months ago. That was a lot of fun. And we just continue to do the best that we can in our Clubhouse to make it a nice, strong, community-based recovery program. Anything that you wanted to add?
No,
I think we spent more than 5 minutes up here.
just a little bit,
Yeah.
but there was
I
2
was
of us.
I was giving you 10 because there's 2 of you up there, you know? And you were
Do
under
you have
the
any
10.
questions?
Board members, are we good? Okay. Thank you both.
Thank you.
Anybody else for public participation?
Hello, good evening. My name is Maria Preventure, and I'm here with my daughter Jessica and my husband Lee. And I tend to talk a lot when I get nervous, so I wrote it down, only to be brief. So we wanted to take just a minute of your time to say something you probably don't hear too often, and that is thank you. We want to thank you, Jessica, Lee, and I, for the work you do and continue to do in order to provide the quality programs here in Macomb County for people like Jessica and her peers. Jessica attends a wonderful program in Washington Township. It's CEO, and Jessica loves attending CEO and learning with her peers. And even though Jessica is nonverbal, we know that Jessica loves her program and CEO by her actions and her transformation this year. There are times when we pick up Jessica and she doesn't want to go home. So that's not saying anything about mom. She just loves her program, right? And in the morning, she's the first one at the door. And I swear if she could drive, she probably would take herself there because mom is not a morning person. The point being is that Jessica is telling us in her own way that she has found friends and a second family in her CEO program. Jessica received skill building and enhanced staffing at CEO. Since attending CEO, we have seen positive changes in Jessica. She's more independent and confident. Her self-care skills have improved, and she's blossomed into a happy, confident young lady. Usually she's smiling, but I think she missed her nap today. I don't know. So for that, we thank you for continuing to strive to find ways to support these wonderful programs which you put in place so that they can continue to provide not only to Jessica, but to her peers the necessary services that she needs in order to improve her quality of life and reach her full potential. And maybe in the process, they too can find friends who have become their second family, like Jessica has. So thank you for your time.
Thank you very much. Anyone else from the public? Come on up.
Thank you for allowing me the time to speak. My name is Kathleen Lewandowski. I'm the Chief Operation Officer of Carl Walker Bun Therapy Clinic. We're right on Garfield and 19. We do occupational, physical therapy, and speech therapy to amazing recipients, and we do indeed help them to change their lives and fulfill goals that they have, be functional, be out in their community. Our clinic has been open for 18 years, and we've been a county provider for 17. We will have our KPIs soon, so I can come back and share that. We're getting CARF accredited, re-accredited actually February, so we're busy tailing all of our numbers. Tatiana from Quality Care came. She's another county provider in November, and she just shared some of the hardship that us providers have been enduring lately, and we so appreciate our county contract. We love the people that we serve. But it's been difficult this last year. We got a little bump in raise for the pandemic, which was greatly appreciated, but I think we all know that after the pandemic, costs just aren't the same as they were pre. We did talk to Daniel Gorgie and the finance department, and they tried to work with us. We did get a 4.47 increase in our rates for OT and PT, but unfortunately speech decreased by 45%. So that is a very, very in-demand therapy, especially since the pandemic. A lot of feeding and issues with communication we found in our recipients. Additionally, there was a code change at the state, which I understand when things change at the state, it's very hard to trickle down through all the departments at CMH. But it came to us kind of late. There wasn't a great rollout, so we didn't have the authorizations to provide services, sometimes for recipients up to 3 weeks, so they didn't get services. And then also we hold a very complicated schedule, I would say, for the recipients that come and get services at our clinic. So during that time, we lost all the revenue from them, and then we were backed up with billing, and then AR, and then cash flow. So it was really difficult coming out of a tough year. Sorry, just lost my agenda, trying to keep this short. So we've made a ton of changes. We've decreased our non-productive staff. We've tried to go from several systems to one to be more efficient, economical. We've tried to renegotiate everything from our paper products to our EMR platforms and our benefits for our staff, but we're just really finding it challenging. I know MCCMH does a ton of things for a ton of individuals, offers a lot of programs. There's a lot of people in need, and we appreciate being part of that. We just hope that you'll consider the therapy providers when you guys are looking into budgets and system changes in that. And I appreciate your time and thank you.
Thank you for being here tonight. Anyone else from the public wishing to speak?
So
Come on up to the microphone.
I would like to, but I would like Jessica to say something. And is it okay if we go around?
Sure, that's fine.
Won't take up very much of your time.
Oh, no, totally fine.
I'd like to visit every one of you, but we don't have that much time.
Well, thank you for coming. Thank you for making the trip in the rain and the fog. Yep, thank you so much. Is there anybody else from the public?
I'm gonna talk first, just a second.
Perfect.
So I don't have anything scripted or anything. My name's Lee Proventra. I'm Jessica's father. We're here on behalf of the CEO program that my wife talked about. She explained it well enough. But for each and every one of you, every person that comes up to this microphone has something that they want or need, and probably not for themselves, but for that program. Because when we said the Pledge of Allegiance, we used the word God. I think I'm okay in saying this, that these are truly the very least of our brothers and sisters. And all of whatsoever you do, that's why you're here. That's the reason that you have volunteered your time and you're being paid and done. It is truly, I don't know how often it's brought to you, but it is truly for the least of your brothers and sisters. So that's what I have to say. Thanks.
Thank you.
You come back from that.
Is there anyone else from the public wishing to speak? Anyone else? All right, there's one more hearing of the public near the end of the meeting. So I will close this one and we'll move on to item 5A, approval of the minutes of the regular meeting of the CMH Full Board held on Tuesday, November 21st, 2023. I'll take a motion to approve.
Second.
Motion from Mark, support from Lori. Any changes, questions about the minutes? Okay, hearing and seeing none, all in favor say aye. Aye. All opposed? Minutes are adopted. We'll move on to item 6, approval of standing committee meeting minutes. We did not have any for program and budget, so we'll go to 6B. Take a motion to approve the CMH Board Program and Budget Committee meeting held on Wednesday, January 10th, 2024.
So moved.
Support.
Motion from Megan, support from Antoinette. Comments, questions, changes to the minutes? Okay, hearing and seeing none, all in favor say aye. Aye. All opposed? Minutes are adopted. Next, we'll move on to item 7, request to approve. We have 3 new items tonight. The others were discussed in committee, so we'll start with the new items and we'll go to item 7A. Take a motion to approve MTHHS Substance Use and Gambling Services fiscal year 2024 amendment that has been approved by legal.
So move. Support.
Come on. Motion from Antoinette, support from Selena. Helen, go ahead. I'm just going to start making
Sure,
it up
thank
now.
you. Yeah.
This is a nice, simple one for us. This is a First Amendment for fiscal year '24 for our general substance use contract. What the state has done is they got language from SAMHSA on defining recovery support services that we've been operating under. So they have now incorporated that into what they refer to as the special provisions portion of our contract, which comes along with any of the specialty grants that we get. So it's really, they just needed to amend the contract, to include that language, and we're saying, yep, we're good with that because we've been following it all along. So that's a very simple, easy amendment for us this time.
Perfect. Thank you, Helen. Are there any questions or comments for Helen on this item? Okay, hearing and seeing none. All in favor, say aye.
Aye.
Aye. All opposed? Motion passes. Next, we'll move on to item 7B. Motion to approve a contract with GovHR for the purpose of assisting in the search for a MCC/MH CEO. And I would like to caveat this with the contract that you saw was between the county, or was between GovHR and CMH. It needs to be between the county and GovHR. So I would like a motion to approve that contract with that caveat.
So moved. Support.
Motion from Megan, support from Lori. Okay, I want to talk about this real quick, and we have our experts from County HR back there. Brian and Jennifer have joined us tonight. Thank you for staying extra late with Commissioner Wallace and I and the rest of the squad. And I believe James is back there hiding from GovHR, smiling. He's excited. So Megan and I have been working on this for a while now in concert with County HR to try to find a search firm to help us in our search for a new CEO. We looked at many different companies, many different organizations. We had, I don't know, maybe half a dozen, maybe more. We compared them all. County HR talked to basically all of them. We received proposals from all of them. All that information has been sent around to all of you to take a look at ahead of time. But I wanted to bring County HR here tonight and James from GovHR in case anybody here had any specific questions to ask them. Their process, how they work, or anything like that. I am going to invite James up here to give a quick little rundown on, what we can expect from you if we go through with this. So James, if you want to come up, or Brian, everybody, y'all want to come up, that's fine. You're here. You made the trip. It's miserable driving out there, so you might as well speak into the mic.
Well, thank you very much. I appreciate the opportunity to be here this evening. Particularly blessed to be here after some of the presentations earlier today. For GovHR, this is, we feel really privileged to be able to help you with this search. We have a lot of experience doing searches for county governments. Particularly, we do several different counties in Michigan. This will be our first opportunity to work with Macomb County, and we're excited for that. In terms of the search for your new CEO position, it's going to start with a conversation individually with me, with each of you on the board and your senior leadership staff. We think the most important part of any search, any of the firms that you interview will bring you probably similar candidates, probably will be able to outreach to same places. I hope we do things different on two ends. The very front end, I really want to understand from each of you what you want out of your next CEO. What are your goals, both for the organization, for that individual? Because you are in a certain place as your organization, and we need to find that individual that will fit where you are right now. That may have been different than 2 years ago or 2 years from. That is both your senior leadership team, also have an opportunity to provide survey to staff, to get input. And I would follow your lead and senior leadership's lead on how far and how much you want me to have those conversations. But that's most important to me, so that then when I can screen candidates, I can tell them with integrity, this is what they need, this is what they hope. Are you a good fit? And it's really easy for me to do that on a phone call or a Zoom, much easier than an interview once we get to the formal piece. The other part that I hope we do pretty well is manage public searches, where interviews are done in public and everything is exposed through Freedom of Information Act. And we want to be respectful to our candidate pool as well as to you. And I do think we've spent a lot of time trying to make sure we get that right balance of getting you enough information on the front end to protect candidate identity. But then in the back end, as soon as anything starts to become close to that interview process, informing and making the candidates comfortable, some who may be entering this type of a situation for the first time, that this is public, and it's not always easy to interview for positions in public. So that's kind of what I hope to bring to you. Maybe it was a little bit longer than you'd hoped for, but I'm happy to answer any questions and really appreciate the recommendation this evening.
Thank you, James. No, that was perfect. And I know Megan and I had a long discussion about, some of the other firms, and some are more geared towards the private sector, some are geared more towards the public sector, and I think we even scared away some of the private sector ones with how we run things. So that was important to us for the firm to have the experience in the public sector, because it is a very different process, having sat through it the last time we were looking for a CEO, as compared to how private industry would run it. So I appreciate that portion of it, and so did Megan. Megan, did you want to add anything to this at all?
I don't.
Okay.
I don't, but I'm super excited. Just that.
Brian, Jennifer, is there anything you two wanted to add?
No, I'll be happy to answer any questions that you have about the process and moving forward, though. Thank you.
Board members, do we have any comments or questions for the team? Antoinette, go ahead. Can you turn on your microphone, please?
Bad habit. I usually do a lot of talking in between. But I just want to say that I am so much in support of this. I'm so grateful for this partnership between you and the county. I was a little nervous because I just feel like there's such a urgency, for this position to be filled, because we do have a lot of work to do, and we can't miss a beat. And of course, we have Tracy and Helen that are doing an awesome job right now. So I did get a little nervous, with our HR department, thinking that's a lot, and then you're going to have, Phil and Megan on your heads, and then I'll just throw in an email as well. But when, this came before us and the partnership was formed, I was very, very happy. And I just know we're going to get great candidates. And I mean, you know what to do. And I put all my trust in you that we will have a CEO that's ready to fulfill this position. Thank you.
Thanks, Antoinette. Donna?
I'm just wondering, if we approve the contract and finalize it tonight, what is the expectation of, how frequently, will you come before us again with candidate selections? When will we be hearing from you again? Can you kind of give us a timeline?
Sure. We'll provide a formal timeline probably in about 2 weeks. But before that period, right after this evening, tomorrow, as soon as tomorrow, I want to start working with the chairperson, the HR folks, however you want to give me the right person to coordinate with. I'm going to immediately request your time for stakeholder interviews. So on an individual basis, I'll schedule Zoom, and we're going to start talking, because within 2 weeks, I want to have those complete so that I can put together the recruitment brochure and recruitment advertisement that we then go out to the public. Once we go out to the public for candidates, you won't hear from me as frequently. I may send a memorandum if you wish. I can certainly come and report how it's going, but we're going to advertise for about 5 weeks. And as those come in, we'll be working with those candidates to understand their interest. I will come back then, and at that point, we can start to customize how I deliver the candidates, but probably either a committee or a closed session to say, here's the pool that we have, without selecting who's going to be interviewed. That's about at that 6-week point. At that point, we're going to have consistent contact through the next 3 to 4 weeks as we schedule interviews, depending on how many you choose. And really at that point, it becomes how much time does everyone want to invest in this? Each candidate that you bring forth is a considerable investment of your time. So you may have 1 round, you may have 2 rounds, you may want to involve the employees in stakeholder contact with candidates. I'll help manage all of that. To direct answer to your question, you will hear from me, and we will have a Zoom meeting probably within 2 weeks. And then you can expect to hear from me. There'll be a little bit of a lag, but then every other week after that 5th week.
Thank you, Donna. There's a board member that is not here tonight, but asked me a question that I'm going to relay to you and see how well I can do this without, looking at the whole contract. There's, section 9 is about mediation. And there's a section in there that or a line in there that pertains to in-person mediation would take place in Florida. Now, I volunteered to go if that needs to take place, but in all seriousness, I'm wondering if that's something, if it ever got to that point, is something that could be done here or over Zoom. I think it was in section 9, if I remember correctly.
Yeah, it's section 9. I've been working with GovHR, now MGT, for 7 years, haven't had to exercise that or have to go to Florida. So I'm not experienced with that myself. I also don't want to speak for our legal team in terms of could you do it via Zoom, could you do it down there? I will share for that board member. I've never had an opportunity to have a dispute, so I'm inexperienced in that way. But I know MGT and GovHR absolutely. The private sector is not where we spend our time. We spend our time in the public sector. We understand that you're serving on this in a capacity that is different than some of other types of contracts, and I'm certain they would be very amenable to any type of dispute resolution, whether it be a Zoom or hopefully we never touch that piece of the contract. If you want a more formal answer, I'm happy to work with Brian to
No, that's fine. We assume that would be a rarity, but we just saw it
Sure.
in there, so had to ask. Megan? And had to volunteer just in case. Megan, go ahead.
Well, I was gonna say.
Turn on your microphone, please, Megan.
Goodness. Okay, so I was gonna say, I'm not an attorney. I know that I see one over there, and the two that are missing are attorneys, so it could be their question. But I will say, it's typical for whoever's writing the agreement that it would be in their backyard, like where it would be. So that doesn't concern me at all. I would say, given if you guys were to ask my professional HR opinion, again, we really did take our time with these, spent meaningful time on it. I am fortunate to kind of walk in the same circles that James walks. He has a stellar reputation, and that's one of the biggest things as a public sector girl who now lives in a private sector world. It is incredibly different. Don't let anybody tell you it's not, because it is. So I really think having somebody with that expertise and just understanding the way that we work, and this is not the norm. So I really am super excited to see what you guys bring us, and thank you, HR team, so much, the unsung heroes. So.
Thanks, Megan. And Donna, just to touch on your comment a little bit, I mean, most of this is going to be done in a personnel committee, which, James, our personnel committee is a committee of the whole, so it's everybody you see here anyway. But that's, we will do most of the work in there until we get a final decision, which will come to full board. But we'll work through that process, and, all the board members will know exactly what steps are being taken when we all need to be involved together and separately and all that good stuff. So having said that, questions, comments, anything else? Anything else you guys would like to add?
Thank you.
All right. Thank you all, James. Brian, Jennifer, thank you for your help. With that, we have a motion and support. All in favor, say aye.
Aye.
Aye. All opposed? Motion passes. All right, next we'll move on to item 7C, which is the last new item. It's I'll take a motion to approve the purchase of 2 vehicles at a cost not exceeding $40,000 each.
Support.
Motion from Selena, support Ryan. So loud over there, Ryan. And I'll turn it over to Tracy.
Pushing the wrong thing. That's part of the problem.
Got you covered. We're a team here, okay?
So what's before you is we annually look at all the vehicles that we have. We have a fleet of about 19 vehicles. We look at the vehicles that are 10 years or older, and also where their repairs are starting to exceed the kind of value of the car. So before you have a request for 2, it's to replace a 2011 and a 2013 vehicle. We're requesting up to $40,000. There's a high likelihood it's going to be closer to 37, but we just wanted to give some cushion there. And I think you guys all know we're working through the process as far as the changing of the vehicles as they become available. I'm sure you guys all know, but vehicles are hard to get these days. So that is why this is coming before you in this fashion.
Thank you, Tracy. And I can just say from a Board of Commissioners standpoint, our fleet director comes to us kind of in the same way. It's last minute, it's hectic, it's frantic, or it's ahead of time, and it's, if these become available and within the next 6 months, we'll snag them exactly when we can. So this is not out of the norm for the county for procuring vehicles. Any questions or comments for Tracy? Okay, I do have a question for Nicole, though. How come she wasn't able to snag those two?
I know, right?
Two up? Because she has been incredible at snagging up vehicles for the county, and for some reason, last minute, and yes, this time it didn't work, so I'm gonna have to ask her why. But not seeing any questions or comments, all in favor, say aye. Aye. All opposed, motion passes. Next, we'll move on to items that were discussed at program and budget. I will take a motion to approve items 7D, E, F, G, and H.
Support.
Motion from Antoinette, support from Ryan. Comments, questions on these items? Okay, hearing and seeing none, all in favor say aye.
Aye.
Aye. All opposed? Motion passes. Next, we'll move on to item 8, receive and file. We have no items to receive and or file. We'll move on to item 9, a resolution for Anthony Tony Plua, who is a former MCCMH board member. I'll take a motion to approve that resolution. Motion from Selena, support from Lori. You should all have this in front of you. This is a memorial resolution. Tony passed away recently, and he's a former board member. He has done so much for Macomb CMH. I'm not going to read the entirety of it, but he was a valuable member of this board, and I know the largest advocate for his son. I've never seen somebody advocate so hard for their child, and he did it at every level. He got himself involved. He not only did it for his son in his family life, he came here, he was with the CAC, and that's what he did. That was his passion. And he was just a fantastic board member, a fantastic person, and I know a lot of us got to know him over the years. Lori has known him for a very long time, and he was a phenomenal person, and we will miss him. Is there any board members that want to make any comments? Lori, go ahead.
Yeah, I've known Tony, I mean, Kevin's gonna be 38, so I've known him since Kevin was 5. He's done so much just for our autistic population that people aren't even aware of. When Kevin was 5 years old, I met Tony in the Macomb County St. Clair Board of Autism when Kevin was diagnosed with autism. And thank God they were there. At that time, they were 5 years old, but they were a parent support group that walked me and so many of us now through the early stages. There was not at one time even an AI program in Macomb Intermediate School District when Ronnie was in school. Tony lobbied to have the ISD have a separate AI program. When Ronnie was in his teens is when the AI program started in Macomb County at the ISD. So he has been an advocate since the birth of Ronnie, and he's been an advocate for all of us in the autism community for many, many years, and he'll be missed.
Thank you, Lori. Thank you, Lori. Anyone else? Okay, seeing no. Ryan, go
I
ahead.
just want to say that he was a really good guy. He was really amazing to talk to, and you know, I didn't know him very well. Like, I didn't know him 35 years, but you didn't have to. Just he had such a warm heart. You know, a really good guy.
Thank you, Ryan. Anyone else? Okay, hearing and seeing none. All in favor, say aye.
Aye.
Aye. All opposed? Motion passes. We will get that resolution printed and given to his family. Next, we'll move on to item 10 is the voucher listings. I'll take a motion to pay the bills. Motion from Mark, support from Donna. Comments, questions on the bills? Okay, seeing none, all in favor say aye.
Aye.
Aye. All opposed? Bills are paid. Ken is happy, and we'll move on to the CFO update. Go ahead, Ken.
No questions on the bills. I'll take it. Good evening, everyone. We have our first set of financials for fiscal year 24. There are some differences and changes compared to prior year, and we'll go through those, but some of them are expected, and we've we've planned for a while, but I'll dive in. Page 2, I think, speaks to where we expected things to go. Public health emergencies ending, we've been talking about it for a while. Eligibles are going down, revenue's going down. We've planned and budgeted for that. We ran some numbers through November. We have not looked at the December payments yet with our considerable year-end reporting things that we have going on, but we're tracking pretty well with our projections on budget compared to what we're actually being paid. So I think we're in good shape from that perspective. Page 3, nothing specifically to touch on here. Towards the end of my presentation, I will talk about some of the things that might be, I guess, in flux as part of our financial statement numbers. But page 3 and 4 are largely projections, and based on November numbers, a lot of our providers working on getting their claims in at the start of their new years and things. So, take that with some consideration. We do book estimates and things to try to capture some of that. But page 5 is where I really want to spend my time in the subsequent page. So you can see at the top there, our Medicaid program doesn't include CCBHC, but we're running at a slight surplus there. So we're tracking right along with our budget there, and same with the Healthy Michigan plan right below it. So we're kind of back in our new normal, if we want to call it that. We have some big changes since the pandemic started, such as CCBHC and a number of other things, but that being one of the biggest ones. So I wanted to highlight those there. We're not going to see those enormous surpluses and lapses back to the state going forward. Next, you can see the CCBHC sections. As always, if you add up the surpluses for both Medicaid and Healthy Michigan, we're at about $1.8 million through the first couple months of the year here. So we're trending nicely on that as far as the CCBHC program goes, and those are the dollars that we'll be able to retain locally. Just as a reminder, you can see there at the bottom, expecting to fully fund our ISF again at the end of '24, based on our actuary analysis, just over $46 million. Going to the next page, this is, you can see we have our CCBHC non-Medicaid section and our general fund section right below it. I've been thinking of these kind of as a combined type item, even though they are separate in a lot of ways. Right now, we don't know what our state allocation from the $5 million GF that they have will be. Last year, we got about $175,000, which is, as you can see, the first 2 months of the year, we're already at about $550,000. So that number is woefully inadequate. But we are advocating, I think, and it's going to be a statewide discussion. They brought on, I think, 14 more CCBHCs this year and did not adjust the $5 million. So small pie being spread to more mouths to feed, I guess, if we want to stick with the analogy. So if you look at those two together, we're actually trending pretty close on GF, but any losses in the CCBHC non-Medicaid will have to be soaked up by GF. So we are running at a net deficit with those two programs. So as expected with the end of the PHE, we've got people rolling off of Medicaid. We don't want to cut off their services, so we've kept the door kind of wide open to, if you're in services, we'll pay for it with GF, and we're working through specific analysis of, is it simply a Medicaid paperwork issue we can help you with? Is it services that are like residential, where if we stop paying for that, that person will have nowhere to go, and start working our way down the thought process of what we're going to spend our GF dollars on. So we are working on those detailed analysis. I don't think it's an enormous issue as we trend through the year. There are some things in the GF expense number that are fixed. We pay for an MDHHS worker at the beginning of the year. That's $75,000. That's in this number, but it's not going to trend out. So we are seeing a lot of CCBHC non-Medicaid people. We can't turn anyone away as part of the CCBHC, so I do expect that number to continue to grow. I might stop there for questions on that piece if there are any. Okay, I will keep rolling on. The rest of the packet, I don't really have anything to touch on in here. The numbers are, I've already talked about what would drive those. I do like to highlight for this group kind of our open items as always. The ISF kind of being the number one dispute we have with the state of Michigan. Recently in an FSR work group, they, I think, canceled or moved it a couple times, so it kind of trickled out, and Richard finally said, we need the FSR bundle adjusted for this. Oddly, even though he's been talking about it for a while, there seemed to be surprise. So that's moving forward. The discussions are being had. We still feel that we're on solid footing, and may even have support at that. I don't know where the state's going to come back with it, so we'll see at the next FSR work group what happens. But we're planning to proceed as is through fiscal 23 reporting. The MyHealthLink state inpatient issue, we have not heard anything back on that. We are giving it a nudge as we try to wrap up the fiscal year. The MAT rate, I know Richard said he had some conversations at the state level as it pertained to that, but ultimately we don't have anything in writing or a definitive answer as to what we're going to do there. I think they heard his concerns and they have validity, and now it's working through what to do about it. So any questions on those kind of standing items that we have? Okay. The last thing I wanted to touch on was the Workday implementation that the county has. We, at this time, I know that the county's working hard on getting that system stood up and working on it. There are certain things that we need from the county to close fiscal year end. I wanted to make this group aware if we don't have those items over the next week or two, as we look at final reporting, we'll probably have to ask for an extension from the state on those items. We also have some fiscal 24 operating issues that don't impact fiscal 23, but it's possible that, I don't think it's the case, but these numbers, as we are trying to run payroll reports and some other things, that these numbers could change. So I want to make the group aware of that possibility as we work through reconciling with the county, as we kind of have two systems trying to run together. So that's all I have.
Ken, are those issues more finance department, HR department for the county? Where the disconnect is?
I think it's finance department. Like, there's certain items that we need to be billed for. When we separated systems, that they can no longer just do a kind of a cash transfer internally. So we actually pay, they send us a bill and we pay it. So we're waiting on some of those items. We also have an interest allocation for pooled dollars that we have with the county, and that goes directly into the calculation of our ISF. We have to report that interest. A certain portion of that interest goes to the ISF, so that's kind of a sticking point at this time. So I think we'll see how the next couple of weeks shake out, but I think if we're going to request an extension, we can certainly let this group know.
Okay, thank you, Ken. Any other, we'll talk after. Any questions or comments for Ken? Okay.
Thank you.
Thank you. Don't leave when we're done. And next we'll turn it over to Tracy for the Interim CEO
I just want
report.
to start with Ken. I'm so excited because literally we're on the same page. If you guys haven't had a chance to read this afternoon, I sent over like a monthly report and some of what Ken's was just saying. So if you do want a little bit more information on the details of what Ken was talking about Workday, you'll find it in that board report if you haven't already had a chance. I'd like to apologize that it's so lengthy. I really did try to pare it down, but it's a lot of information. And I welcome your feedback too on, is that too much? Is that not enough? Or other, if you're interested in other subjects. That being said, in addition to what he just said, it does mention kind of the Workday glitches that are being worked through and kind of the strategy that Ken mentioned that, if we needed, we'll notify the state, we'll ask for an extension. There might be future concerns, but we're kind of still in a state of waiting and seeing what they can get. And I know that the county has been very responsive. It's just, there's a lot of competing priorities there and we're trying to, work with them to get to the solution. Other things, just as I will only, I promise, not read the extensive information, but I do want to draw your attention to some brief highlights. The Medicaid health plans are currently in the bidding process. The bids were extended, so they still have, I want to say it's 2 more weeks. Don't hold me to the exact time frame. When you read it, I'm going to summarize what it says. Essentially, the good news is, and we already knew this to be true, but again today in a director's meeting, the state of Michigan confirmed that the way that they have structured it, and I don't want to go into the long name, but the DSNPs and FIDEs, we've all heard those acronyms before, because of the way they structure it, there's not a carve out for behavioral health. So that puts us in a very good place. But one of the recommendations is they do have a small behavioral health service line, right? So we do want to partner with the ones that work well, and we will continue to do that. If you don't know that, we already have partnerships through the My Health Link with Molina and HAP. We have a pretty good relationship with them in that, so we'll try to continue to expand that relationship. So there's not a threat there, but there is a possibility for us to better partner once they get their, if they're renewed or move forward. Okay, other things real quick are, Ken earlier, that's why I think with Ken I was excited, all your subjects, I have the same subjects, so we're on the same page. The CCBHC, specifically, at the federal government level, this rule has already been in place, which is 51% of the provision of services have to be provided directly by the organization who is the CCBHC. The state of Michigan really hasn't focused on that, and they haven't made you prove it or whatever, so now they're currently in the process of looking into potentially making you prove that. So we are working with them to identify what would be those codes, what does that even look like? Because as you know, numbers are all about how you define them and how you're looking at them and where you're pulling them from. So we're just giving you a heads up on that because that potentially will impact us in the way that we might have less DCOs depending on how they pull that information. So it's just kind of a heads up, but it might change our design a tiny bit. Other things is you'll see the conflict-free case management. As you know, it's still a hot topic. Today, DHS was explaining that there's not a current due date. They still have a tentative implementation date of 10/1/2024, but they are working with a consulting organization. We, as our organization, have a meeting with that consulting group to try to find out what does this region currently do in order to address that particular subject. They're doing that with all the regions. Then we're tentatively happy that the goal would be to collect information and try to see what good systems already exist within organizations instead of dramatically changing how the structure is. Each region ultimately will have to submit a plan. So once they go through this process, we will have to show how we're doing that. They do have kind of exemptions, but they would be very, very, very rare is how it was reported. Other quick things are AOT funding opportunity. We're still researching as early as Friday, submit interest request for AOT funding. The state of Michigan has an opportunity for us to possibly pursue and submit for a creative solution to expand our AOT program. It's not really designed for clinical staff. Our AOTs are dramatically increasing. I'm sure as you know, as the mental health needs of the individuals in the public increase, of course, the use of the AOTs, and I should back up, AOT is assisted outpatient treatment. It is basically a legal mechanism for an individual such as ourselves or organization to assist an individual or enforce them to receive treatment with, of course, the partnership of the local probate court. So we have a large number of individuals that AOT requests are increasing on. So we need the staff to follow through on them. The purpose of those is to help the individual. Well, if you don't have the staff to make sure they follow through, then obviously it creates a bad situation. What we're gonna be submitting though is not necessarily for staff, because that's not one of the choices. We're currently considering submitting for, maybe partnering with Airfoil or an organization to create better educational materials. A lot of times we run into stigma, we run into people not understanding what it is and that it is helpful. It's not supposed to be looked at as a law enforcement document, even though it ultimately is. So again, currently we're trying to be creative and look at, can we create some videos, written materials, that type of thing to educate the public on that opportunity, is the way we're kind of looking at it. And then I think you have a ton of other things in there, but I won't read them because they're pretty straightforward. The pocket guide is finally out, if you guys remember this. Yes, we're very, very excited. This has been given to, the sheriffs do have it in their hands, and they're gonna do it in their CPT training and hand it out. We're currently also trying to get it to all the different police departments and make sure they understand, and we ordered 5,000, but we'll happily order more as needed. And for anybody who doesn't know what it is, it's supposed to be a very simple guide. It's really designed for police officers, but of course anybody could use it, where if you needed assistance with the most typical things a police officer might run into: domestic violence, substance use, mental health, those types of things. And it's a quick phone number, QR code, or whatever is needed to get them to the next steps. And that is it.
Thank you, Tracy. Comments or questions for Tracy? All right. We'll read the email and then we'll give you questions.
Yeah.
Thank you, Tracy. All right, with that, we will move on to other possible agenda items. Just a couple of reminders. We will have Program and Budget Committee here on Valentine's Day. Ryan will be chairing at 6 p.m. And full board will be here on Wednesday, February 28th at 6 p.m. as well. And we'll move on to, well, do any board members have anything else they'd like to discuss or add or comment on? Okay, we'll move on to the final hearing of the public. Anybody from the public wishing to speak? Anybody from the public? Bruce? All right, we'll close the hearing of the public, and I will take a motion to adjourn. All in favor? Aye. We are adjourned. Thank you, everybody.